Hello and welcome. My name is Dr. Rizwan Qureshi, and today I'm going to talk about, is it possible to get a job after AMC Part 1 only? The short answer is yes. Australian healthcare and social sector is the largest employer in the country, with growth of nearly 20% over the last 5 years, and it will continue to grow with an increase in aging population in Australia. Also, recently, due to post-COVID hospital crowding and emergency department access block, the chances of getting a job after AMC 1 are better, but you need to be ready for this. So how does one get job after AMC Part 1? Well, as long as you're able to convince the employer that you have the essential qualifications and experience to match their job requirements, you will be given a job. But obviously, it is not as simple as that. Let's divide this conversation into following topics. Number 1, passing AMC exam. That is AMC Part 1. What qualifications are required after AMC Part 1 to be able to secure a job? Skills requirement. What jobs are you likely to get? The job application process itself. Working to improve your employability. Registration with AHPRA. Visa status. WBA programs. And finally, I'll give you summary and recommendations. So without further ado, let's jump right into it. Congratulations on passing this exam. It is a very simple exam based on final year medical, surgical and allied subjects and very similar to PLAB Part 1 exam. It has got a current average pass rate of about 58 to 60% in the first attempt. You're now eligible to apply for a standard pathway for a limited registration if the job is offered after AMC Part 1. Now, what qualifications do you need to have to apply for a job after AMC Part 1? Well, basically, your MBBS from World Directory of Medical Schools, plus English level exams like OET and IELTS. Any further qualifications like postgraduate exams like MRCP, MRCS or MRCEM are a big plus, even though they might not be recognized, but they do show your level of commitment. Even local fellowship exams from your country of origin like FCPS and board exams in India are able to show or demonstrate to the employer that you are committed in that particular specialty. What skills do I need to have a job offer after AMC 1? Now, this is very important. It is ideal to have a documentary evidence of resuscitation skills like BLS, ALS and APLS courses. But the more courses you have in this regard, the better it is for you. Also, clinical communication skills via the courses and workshop, but clinical experience demonstrating your effective clinical communication skills. One of the most important things that the recruiters look into is your procedural skills at a junior medical officer level, like patient assessment, putting in cannula, taking bloods, putting in the catheters, suturing and basic wound management. Either you can show them through your work experience, or you may have done a recent workshop here in Australia to demonstrate that you are quite apt of doing these essential procedural skills. Most doctors who've been able to get the job after AMC Part 1 have got less than 12 months of clinical gap with at least 24 months of clinical experience in emergency medicine, acute medicine, pediatrics and ICU. These are what I call bread and butter specialties that create opportunity for you to get jobs easier, especially in countries like Australia and the UK. So what jobs are you likely to get after AMC 1 only? It is very much demand and supply situation. Australian government has recently announced hiring 2,000 medical professionals. Best chances of securing a job are in emergency department because they are most overcrowded and risk prone. Also, general medical jobs, as majority of the patients admitted from the emergency departments are admitted in the hospital beds and looked after by specialties like geriatrics, general medicine, cardiology, respiratory medicine, and some areas are really struggling, including the regional areas and semi-rural areas in all states. The job application process. Every state have their own recruitment website, and you need to be familiar with the search process and the job applications. The application forms are designed to get essential information regarding your qualification, skills, and some governance question to which you must have a comprehensive but short and punchy answer. It's often the application forms that will get you shortlisted. Make sure that your CV is in a required format and it is not too detailed and presents all the relevant information on the first page. Once you get shortlisted, it means that the employers are happy with your qualification and skills required for the job. You must now practice for the interviews in order to stand a best chance of being employed. This is often not done properly and creates a lot of disappointments to the candidates. Also, please make sure that your references are up to date and they are ready to give you reference on your behalf, as most references are now collected before the interviews. Now, please register for Emergency Focus Medical Career Guidance course for a complete video guide on step-by-step instruction on CV, application forms, and interview questions. Working to improve your employability. The best chance of obtaining a job is whilst you're showing some sort of commitment. Clinical observation in a GP or hospital setting, clinical orientation courses, resuscitation, procedural skill courses show the employer that you are not sitting idle but improving your practical understanding of the local health system. So please register for our courses, Emergency Focus CPD courses and workshops. Most of our courses are online and the link is in description below. Over the last 12 months, a number of our participants have been able to secure a job after AMC 1 through our courses because of increased understanding of the local health system. Finally, registration with AHPRA. Once you've been offered a job, take the hospital paperwork and apply for a limited registration with AHPRA as a part of standard pathway. Clarify with the hospital offering the job that what level of supervision it provides. At most IMGs would require level 1 supervision, likely after AMC 1. Based on your career gaps, AHPRA may request additional recency of practice, so please orient yourself with those if these rules are applicable to you. Visa status. As a rule, hospitals would prefer Australian citizen and permanent residents when offering jobs. However, if you have strong credentials, you will be given preference over permanent resident and Australian citizen, as hospitals are seeking to recruit safe doctors who fulfill the qualification, skills, and recency criteria with minimal gaps. That is why in the last 12 months, we've seen most doctors being offered visas for taking up their first jobs in Australia. Some of the doctors are even offered a job directly in India and Pakistan. What about the WBA programs? Another route after AMC 1 to get job is to apply for work-based assessment program, also called WBA program. However, these programs are linked to a job, meaning that you have to be accepted into a job first, linked to the WBA program. These jobs are far and few and often very competitive. The preference is given to the doctors who have shown their commitment to that hospital by doing at least 6 to 12 months of a job with them and have not yet passed the AMC 2 clinical exam. So in final summary and my recommendations, yes, it is definitely possible to have job after AMC 1, and recently we have seen multiple examples of many doctors being offered job after AMC 1. However, best chances are for doctors who have worked for at least 2 to 3 years and have got good solid postgraduate experience in bread and butter specialties like emergency department, acute medicine, cardiology, ICU, because these show your employability in acute areas where the hospitals require most medical workforce. We have seen sometimes doctors with good overseas clinical experience are given preference to the candidates with limited clinical experience, even with AMC Clinical Part 2. So there is no justification to sit idle, but to improve your clinical experience back home when you're still in Pakistan, India, Bangladesh, or any other country, whilst you're sitting your AMC Part 1 or you're waiting for AMC Part 2 dates. The most successful doctors are the ones with strong written and verbal communication skills who would outperform in application and interview process compared to their peers. So join our clinical orientation courses with workshops to be one of the doctors to secure a job after AMC 1. Thank you very much and good luck.